Christian Wright is with me now, speech language therapist. You're always great to have you with us, and thanks for coming in. Morning.
You're welcome, thank you.
And Christian also very kindly takes questions from you, 9-to-noon@rnz.co.nz, or anything else you want to share. Today our topic is when toddlers aren't talking yet and how parents can help. So we're focusing in on children around 2.
Yeah, I've chosen 2 because that's often when parents start to be concerned. So by the second birthday, some of the signs of language struggle are emerging, and the parents are picking up on it because they're experts in 2-year-olds because they have a 2-year-old and the 2-year-old has friends, so that's the age group they're sort of knowledgeable about. Just as a rough sort of what should be normal, so 12 months old, child says their first word. Obviously prior to that they're doing things like eye contact, babble, some word attempts, playing with intonation, gestures like waving and reaching and that kind of stuff. And then by 2, they've usually got somewhere between 50 to 100 words. Those words would be a spread of nouns, verbs, some social words, some adjectives, some prepositions, position words.
Possibly a couple of swears.
My child does. He's 3. He has a filthy mouth because we have teenagers in the house, sadly, and I'm just waiting for him to be expelled from kindy.
So 2 is the last age of innocence on that front.
Depending on who else is in your house. But anyway, moving on. By 2, they're starting to put 2 words together, which is a key milestone that you're looking for. And they're roughly about 50% intelligible to the family. So they're not exactly clear to everybody, but you know because you're used to the way they talk. And for a lot of parents, so what I'm going to talk about are the common signs that I see that present in my clinic. So they would be things like, the very first one is the limited range of words. So the child turns up and they're 2, or around about 2, and they're only producing maybe 20 or 30 single words. So they're a bit behind that 50-word milestone. They're not combining. They've got a limited sound repertoire. So, for example, a lot of words are sounding the same. They might have bar, which means bath, baby, bottle. So there's not a lot of diversity in their sound system. They are using a lot of gesture or pulling people by the hand to things of interest because words are tricky for them to say. And as a consequence, they tend to have a lot of tantrums, more than your usual 2-year-old often. I mean, of course, that's personality dependent, but...
They're frustrated.
Absolutely frustrated, that's right. So usually how I respond to that with a parent, and what I would encourage a parent who's concerned, is start a language log, if you haven't already. Start noting down the words they're saying. Do it across 2 weeks. Note down as often as you can the words that they're saying. And when you do it, write next to it whether it was spontaneous or whether it was imitated. That's important. Spontaneous because they own the word. The imitation gives you an idea of how good their imitation skills are, because that's a critical part of language learning. And then when you sit back and look at that, what you should see is about half of what they've said is nouns, about 20% of it's kind of verbs, 10% of it is social words like hi, bye, thank you, or ta, or whatever they say. And then the remaining 20% would be a smattering of adjectives, pronouns like I, me, my, mine. It's all egocentric because kids are always about themselves because that's a survival instinct. And some position words like in, on, maybe, under. And you're looking to see, is there any combination happening in that sample that you've taken? And so the reason I get parents to do that is sometimes they realise the child's actually saying a lot more than they realised. That's the first thing. And so they're usually not far off word combining. So if they've got 50 or more words, it's not long after that word combining begins. And then going from there, if there are concerns, what are the usual causes of these issues? So they would be, the number one that I see mostly is a late talker. Sounds like it's an obvious description, but it actually means something, which is between 18 and 30 months, a late talker is a child who has normal hearing, their general development is fine, so they play, socialise, they think as you would expect. Even their understanding is good, but their expressive language is very limited. And this affects roughly about, 13% is a random number, but roughly, it's not a highly common thing, but when children present to me in the clinic and everything's generally going quite well, that's what I'm thinking, this child's a late talker. And they're usually by 2, they're producing 20 or 30 words and they're not doing any combinations. And then what happens is, for that group, the majority go on to be fine. Some therapy can help, of course. But then there's about 20 to 30% of them that don't. They get stuck and they go on with persistent language delay. The hard thing is working out who's going to progress and who's not, and that's always a hard one. So that's the first category, late talker. The second one would be the obvious, which is hearing issues, glue ear. So that's can be an obvious one where the child's pulling at their ear, but sometimes it's not. Sometimes it's silent. The fluid is in the ear, but it's not creating enough pressure on the eardrum to register pain. So the child's not hearing very well, and their language journey is being impacted by it. And with there being no pain, we can float along, as I did myself. One of my own children, when he was 3, had glue ear and needed 2 sets of grommets. But he also used to look down the hose when his sister would turn it on, so I got a bit worried about his cognition too. But anyway, it turned out he's fine. He's studying to be a nurse now, so he'll be all right. But it's something to be aware of. If your child's getting recurrent ear infections, go to your GP and keep going until you get to the point that you've had a conversation about, do we need to go to an ENT? Do we need to do grommet surgery? There's a lot of pressure on these kinds of surgeries. I'm noticing that things are going a lot later now, but still, it's a really big factor for a lot of kids. Another one would be that the child has like a speech sound disorder. So that is, their sound system is very restricted, so they aren't producing the normal range of sounds.
Is that a hearing-related issue or
can be
processing-related issue?
Can be, that's right. There can be lots of other reasons contributing to that, but sometimes hearing's fine, cognition's fine. They're just having trouble with making speech sounds. They're just slow in that area, or they have a rare condition called childhood apraxia of speech, but that's 1 or 2 children in 1,000. It's not a very common condition, but that's a condition where the child knows what they want to say, but the brain is having trouble coordinating the lips and the tongue to make the sounds, and so it's characterized by effortful, inconsistent speech. And then the last area, which again is not very common, would be a condition like the child has autism, they've got an intellectual difficulty, something like that might be putting a lot of pressure on the language.
All right, so there's a lot going on there. So let's go back to where we were with our delayed speaker, and most will just, what do we call them, late talker.
Late talker,
most will just go on to be fine. Does it suddenly come with a rush at some point, like a aha?
Can do.
Or what? Yeah.
Yep, I've seen that.
Yeah.
And I'm always cautious about that, because when I see that there's an explosion happening, then I start to slow things down a bit with therapy. And I've just learned as you got older that when you see that, you start to relax a bit and you always make it clear to the parent, this child's going to be fine. It's not some magic that therapy did. It didn't. The child actually is spontaneously recovering.
Just got onto it, yeah. Yep. For the 20 to 30% then where that's not happening, is this a case where you mentioned you're checking out all of these things, you're seeking the appropriate diagnosis, I guess, or the appropriate reason, and that could be quite the journey, and you need some persistence.
Yes, you do, and some encouragement too. It's hard for a parent. One of our own children had a language delay, and I didn't feel like I had a lot of patience for it, to be really honest, which is bizarre because of what I do. My wife actually treated him, but there are things you can do, and that's the thing that I want to spend the last bit on is what to do about it. So a child who's slow in their language development, it's their expressive language we're talking about, but your comprehension underpins your expressive language, so we want to support both. So the very first thing I do is I always follow the child's interest, because where their interest is where the language is going to go, and that just makes a really unambiguous association between an object and a word. So you follow the child's interest, and then I've said it once before, but I'll say it again, you say less. It's a rhyme. Say less, stress, go slow and show. And what that means is reduce your language down, ideally to the single word level for this child, because they're trying to maybe produce single words, or you're just putting 2 words together because they're predominantly a single word user but they're not yet combining. When you choose the 2 words to put together, try if you can, based on your language log, to put together 2 words you know the child's confident in saying. So 2 words that you've written spontaneous next to. And that is good, because then the child already has within their language network in their brain an understanding of what this word is and how it functions, and they'll have a lot more success putting those together. So say less. Stress means emphasize the key words. So bring attention to it, colour it with your voice. Go slow, which just means say it, then wait. Let the child think about it. Don't bombard them with phrase after phrase after phrase. Just keep it really simple. And show being the last one. Try to gesturally or physically show them what you meant. So if it's push car, then you put your hand on the car and you go push car. So then you push like that, put a bit of emphasis into it as you highlight the verb moving across the ground.
It's an action word, it's something's happening.
It is happening, and that's one of the reasons it's difficult for kids, because nouns, they're used to acquiring nouns, and that's why that comes first, because they're objects. You can touch them, throw them, smell them, taste them. Verbs
this
only
is conceptual.
It's easy to, it's concrete, but verbs are not. They are harder. They are for children. They only exist in the moment the action is occurring, like pen, but then you start writing and all of a sudden you say write. But then you put the pen down and the child says write, and then you say no, it's pen. So the verb, it's quite confusing, like isn't it? So cognitively you can see the leap they're having to make.
Yeah. All right. And with that, is it also a case of a bit of patience and see, once you see those combined, the two words combination coming together correctly, you can relax a little bit?
Somewhat.
But what should happen then? What should you see beyond the combining of the two words?
The two words would you would see a growth in their two-word vocabulary up to the point that when half of what they're saying is two-word combinations, so roughly half, then you start to see three words.
So you're wanting to see progress. It's not just that you've worked very hard on this combination and that's enough for a couple of them.
Right.
You're wanting to see them getting it.
You're trying to teach them that cognitively two linguistic concepts can coexist. They can come into the same speaking moment. So a child who goes push car, that's not really two words being combined. There's too much of a broken gap. You're looking for a closer...
you're looking for them relating to each other.
That you are, and that it feels easy as the child says it.
The three words thing, is there again a sort of a typical milestone where that will come in, is it?
Yeah, when half of what they say is two words, you see three words. That's pretty common. And often I'll cheat the system by using a word like please or more, and I'll put that onto something they're already saying. So they'll say, want cracker, let's just say they say that. So they'll go, want cracker, please. So we just start showing them how to tag on one of these social words at either end. And often what I'll teach parents to do is, it's sort of counterintuitive, but you should say less, like as I was saying before, but try not to overwhelm them. Comment more and question less. Often when we're concerned, we start questioning the child a lot, asking them what and where and these kinds of things. And those are useful things to ask further down the line.
But we're overloading them when they're still at a delicate phase
Correct.
of learning the first thing.
Well, questions test and comments teach. That's really important to keep in mind.
I just thought of something and now it slipped out of my head. Do you worry less about whether what they're saying in those two words is perfectly grammatically correct than the fact that they're trying to do it?
That's right. The grammatical relationship doesn't really exist until you get into the 3 to 4 word level. At the 2 word level, it's a semantic relationship. It's just meaning related.
So me car or me this or...
That's absolutely permissible.
You want to get to me pushing the car, I know, but it's getting the relationship between the two words.
That's right.
Okay, all right. A question here with multiples, twins, etc. Are there particular issues with all language development that tends to come up with twins or triplets? Did they tend to learn differently compared to siblings, for example?
No, not necessarily. I know children, people who have twins, and their language development journey has been very typical. But I think sometimes what can happen is that in utero, in multiple birth situations, there can be a difference in how certain babies are thriving in utero. So they come out, one's a lot smaller, for example, and one's a lot bigger. And so it's not so much a failure to thrive, but we see differences in their rate of development as they go through the preschool years related to how they started.
I think the question might be that they're focused on each other more than the parent necessarily. That's kind of an interesting situation, isn't it?
Yeah, that is interesting. And that would be I'm just thinking of I did treat some twins once, and what I found was their personalities played a big part in that.
Yeah.
So one was quite an extrovert and really wanted to interact with me, whereas the other stayed very close to the parent. And you can imagine who progressed quicker.
They might have their own code. They might not be interested in talking to us. Yeah. So back to where we were, which is that, relax, just do the basics. You can see some late talkers. Most will go on to get it.
Yes.
And if that's not happening and you're really worried, there could be any number of issues. You need to get on the old treadmill.
You do.
Starting with a GP typically?
No, because you can.
Where?
Well, you can actually. It's a good question. You can self-refer. You don't need to worry. You can either refer yourself to your local Ministry of Education office and ask to talk to a speech therapist.
Yeah.
Or you can go private and self-refer.
Would you check the glue ear thing first?
Yes, you would.
The hearing first. And then if there's not an obvious solution there, you're on to some other professional support.
Yeah.
And most schools and education facilities, well, in this case, we're talking preschools, aren't we? What's the availability of speech therapy? Yes, go private if you can, but
yeah, it's a bit hit and miss, if I'm really honest. So my experience has been they will visit every 4 to 5 weeks. They're doing their best. It's an overwhelmed service. Some great people working in it, but so often what ends up happening is they just don't have enough time and availability.
Christian, thank you as always for your time. Christian Wright is a speech and language therapist in Wellington.